Joining us right now, one of the key players in the health care debate, Virginia Congressman Eric Cantor, the House Republican whip. Good morning, Congressman Cantor.
Good morning, Maggie.
Do you think that these things, these tax increases, these fees, these cuts to Medicare up front are a reasonable price to pay for health care reform? I mean, won't we have to give up something to make this happen?
Well, Maggie, let's look at it. The claims that we're saving $81 billion by spending $829 billion, you can say that if you want to go ahead and really rob Peter to pay Paul, and that's exactly what's going on here. The way that they are expanding coverage is by taxing employers, is by taxing those of us who have insurance, and frankly, to the tune of $500 billion. And they're adding on top of that $400 billion worth of cuts to Medicare, that will mean seniors will have less opportunity, less benefit, less ability to choose the kind of health care that they want. And this is not the kind of health care reform that's going to actually bring down costs that will provide coverage to all Americans. Right away, this Congressional Budget Office says that we'll still have 7 or 8% of Americans who are uninsured over a 10-year period. Again, this bill is going to cost on average $30,000 for each individual to be insured, at a significant cost in terms of levying new taxes on those people who are insured and on employers.
Do you think that it would behoove Democrats, as Karl Rove suggests in his op-ed piece in the Wall Street Journal today, to give up this fight for health care reform because it's facing growing opposition, or face the same fate that they faced in '94 when they lost control of Congress?
Well, Maggie, what I think would behoove us all in this country is to see if we in Congress could try and work together for a change. In the House, as you know, the bill that will make its way to the floor will most likely have what Speaker Pelosi continues to insist is a public option. That has been resoundingly rejected by the American people. And so today I'm going to sit down with Majority Leader Hoyer and try to look at the things that we can agree upon. Because we as Republicans in the House want to reject the notion of the government takeover. We want to stop the government from getting in between patients and their doctors, and try and focus on the kinds of things that can help people have better access at a lower cost.
Congressman Eric Cantor, everyone hopes that you can find middle ground here. Thank you very much.
Thank you, Maggie.
Now over to you, Harry.